Okay, well, welcome everyone, ladies and gentlemen, to our virtual 16th Annual Khmer Health Forum. It's an honor and my pleasure to serve as your MC. My name is Pat Kadechia. So to start, I would like to invite Jessica Khan, our second grader at Whittier Elementary School, to do the Pledge of Allegiance both in English and Khmer. Jessica, would you please lead us for the Pledge of Allegiance?
Please stand up, put your right hand over your heart and face the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. ខ្ញុំសូមសេចក្ដីប្រណិធាននូវភក្ដីភាពចំពោះទង់ជាតិសហរដ្ឋអាមេរិកនិងចំពោះសាធារណរដ្ឋដែលតំណាងប្រជាជាតិមួយក្រោមអំណាចព្រះដែលមិនអាចបំបែកបានជាមួយសេរីភាពនិងយុត្តិធម៌សម្រាប់ពលរដ្ឋទាំងអស់ Please be seated. Thank you.
Thank you, Jessica. Now, I would like to invite Ms. Chan Hobson to do a moment of silence in honor of late Miss Marian O'Donnell.
A son or a daughter is the reflection of their mother. Personally, when I see a wonderful man or a wonderful lady, my thought goes to their mother, who have a loving and kind-hearted. I strongly believe that the mother are the first person that shape and pave the path for the son and daughter for the future. Late Miss Marian O'Donnell was a great loving mother who raised her son, Assembly Patrick O'Donnell, to be a person with deep empathy and compassion. Let us take a moment to pause and honor the late Miss Marian O'Donnell. Let's start. Thank you.
Thank you, Ms. Chan Hobson. Next, I have the honor and pleasure to bring up the next speaker, and I'd like to read a little bit about her, and that is our Councilwoman Dr. Suli Saro. So just to give you a little biography, our Councilwoman Suli Saro represents District 6 in Long Beach City Council and is the first Cambodian American Long Beach City Council member. She served as a field representative for the office of former State Senator Ricardo Lara, and Ms. Suli was former chair of Long Beach Citizen Police Complaint Commission. She holds a doctorate in education in organizational leadership from the University of La Verne. She also currently works as an adjunct professor at Cal State LA and serves as a project development specialist to the San Gabriel and Lower Los Angeles Rivers and Mountains Conservancy. It's my honor and pleasure to invite Dr. Suli Sauer, our first Cambodian American District Councilwoman, to lead the opening remarks. Dr. Suli.
Thank you so much for the introduction, Dr. Jia. I am honored to be here to provide the opening remarks. I want to thank Ms. Chan Hobson, the sponsors, and the volunteer for your hard work. Doing a virtual event is a logistic orchestra to get this done, and I congratulate you on conducting your first virtual event. And I think I'm just so excited for today's event because it's so important that we provide education to the community in language. I know there's a translator on right now providing translation in Khmer, and so many things happening behind the scene to make sure we're getting the right information, not just to protect ourselves, but our friends and our families, as well as our neighbors, and also doing some self-care work. So, and we are just so fortunate to have an amazing health officer, Dr. Anissa Davis, to lead us through this pandemic. And I'm so glad she's going to be here today to provide remarks, as well as physicians such as Dr. Nicholas as well as all of our social community and health workers that are bilingual. I myself could definitely use a lot of the things that are going to be taught here today. I'm a mom as well, so I've been teaching online and also helping my son virtually. And sometimes it's really hard to find a balance. Oh, speaking of children, here she is now. Good timing. So I am so happy to now introduce our next speaker, Assemblymember O'Donnell. My deep condolences to him and his family. And Assemblymember O'Donnell represents the 70th State Assembly District, which includes the city of Long Beach, city of San Pedro, Signal Hill, and Catalina Island. As chair of the Assembly Education Committee, Assemblymember O'Donnell has advocated for increased funding for the K-12 schools, as well as ensuring English learners have access to core curriculum, and as well as funding for career technical, vocational educational programs, and as well as an expanding investment for school facilities. So he's definitely a champion for our students to making sure that we have the funding needed, as particularly to establish the Cal State University Center to close the opportunity gap, which is housed at Cal State Long Beach. He's born and raised in Long Beach and has graduated from the Cal State Long Beach with a degree in history and has a master's in public administration from Cal State LA as well. So without further ado, thank you for joining us today, Assemblymember Patrick O'Donnell.
Well, thank you, Suli. I think it's wonderful that you're on City Council. You're going to be a great voice for Long Beach. You're going to be a great voice for the Cambodian community. In fact, you already are. I think today we're surrounded by professional women. So I appreciate that very much. And I want to thank you for recognizing my mother, who herself was a professional woman, an educational administrator in a local school district for many years, ran child development programs, and was very dedicated to children and kind of infused that in our own children. So thank you for recognizing my mother in that moment of silence. My family and I thank you very much. And I certainly want to thank Chan Hobson for all she does to bring the Cambodian community and others together. Really, it's Cambodian community awareness within the Cambodian community, but also on the outside, because there's a lot of people that don't understand the struggles, the challenges, the successes of the Cambodian community. So anything we can do to highlight that through Chan, through Suli Saro, council member for the 6th district, I think is a good thing. So I just want to say how proud I am of this organization for all they do to serve our community. And our community is better because of the Cambodian community. And with that, it's my opportunity to introduce another professional woman here, and that's Dr. Nicholas from TCC, the Children's Health Clinic, who does a great job of serving our community, children and beyond, right? To take care of their health needs, and not just in Long Beach, quite frankly. So it's a big organization. People, every time I talk to her, I learn something new about how big her organization and how much they do. They do a lot. They do a lot for Long Beach and outside of Long Beach. Really, the region, I guess, is the best way to describe it, serving the health needs of the community. But it is my job to introduce her, a very professional person, capable. And with that, I'm going to be quiet because I'm also here to listen, not just to talk. So I believe I'm handing it off to Dr. Nicholas now. So thank you, Chan. Thank you, Councilmember Saro. And to you, Dr. Nicholas, take off.
Thank you so much, Assemblyman O'Donnell. I really appreciate everything you do and all the support you've given us through the years, and look forward to working with you. I want to thank Chan for inviting me today. I always enjoy this event a great deal, and I was looking forward to being there in person. And Councilwoman Saro Suli, I'm really pleased to have you as our new councilwoman. And I remember years back when we sat and dreamed about, changing Long Beach for the better in the early days of building healthy communities. So welcome to your leadership role. I'm really thrilled. So I'm going to go through quickly just a few slides about TCC, and then we're going to talk about the vaccine and the difference between flu and coronavirus, and try to answer some of the questions that Chan gave me. And I appreciate all the work she does and these events. So Lindy will be, who works for us, will be our MC, will be doing my slides for me. So next slide. There we go. So I think this is very quick. We're now 13 community health centers. We do about 40,000 patients a year that we take care of in 140,000 visits. And we have 440 staff. We probably have over 35 Cambodian employees right now. So we're actually one of the biggest Cambodian employers, nonprofits in the community. And I'm very proud to serve that community. Next slide. We just want people to know that we are open for service and we're here to serve those that don't have access to a health home. We take people that don't have insurance. We help them get enrolled in what they need. And we are doing both telephone visits for patient safety, but in person. We're also giving out a lot of food along with our Cambodian serving partners. We even can help with some rental assistance in some cases. So next slide. So these are our sites. And these are another program we have is the Flourishing Families Long Beach and Innovation 2. And these are some of our partners. And this program is to help, next slide, with helping the community address childhood trauma and intergenerational traumas through some really important activities that are done by most of our partners. Next slide. We also are developing a curriculum development for the community on trauma, childhood adversity, and resiliency and promoting healing. And for Assemblyman O'Donnell, this is funded from the Mental Health Services Act through the state and the Department of Mental Health. Next slide. And we are in the midst of gathering funds, but we are going to break ground towards the end of May in a new TCC Family Health and Wellness Center that will be located in Anaheim and Walnut. And those of you in Cambodia town know that big lot. And they will be 88 units of affordable and supportive housing above our health center. Next slide. This is our health center. We're going to be partnering with many in the community. Next slide. And these are some of the activities that we are planning on doing this, but this is also this is being designed with the community input. So we are open to suggestions. So now this is what life has been about. And we all know how hard this has been. I have seen such tremendous ability to be flexible and commitment of my staff. I want to thank them all. We have been doing over 520 visits a day during this time, and I just want to thank them publicly for everything they've done. Many people are asking, what is the difference between flu and COVID-19? Why do we need to get the flu vaccine? Why do we need to get the COVID vaccine? So I think they are very similar. Now, COVID-19 was hitting, and we thought our peak was in the summer, but again, we have this new peak that's even worse. Flu usually isn't around in the summer. So they both can have fever and fatigue and cough and sore throat and headaches, runny nose, shortness of breath, body aches, and stomach and GI symptoms. But the flu the onset is much faster. They are both spread through droplets and respiratory, but also from touching if you have touched something, you can then get it. But the COVID-19 onset can be a lot later. So it's anywhere between 2 and 14 days. And both of them are infectious before you even have symptoms. So I think that's important. 3 things that are really different about COVID-19 is the loss of taste or smell, and the swollen and red eyes, and some skin rashes, and even things called COVID toes. So again, they are 2 different diseases. Flu virus can change almost every year. Now, we don't know if COVID-19 or the coronavirus will do the same thing. And I was just reading this morning that some of them may be changing a little bit. So the flu vaccine actually changes every year. And even if we don't kind of guess what the right viruses are within the flu vaccine that they protect against, we know that you're either wholly protected against the flu or you get a milder case. So especially during this season when we have both, it's very important for people to get their flu vaccine so that we can not get our focus on both flu and COVID, which is it, and testing for both. So this would really help us if people get their flu vaccine now while we're waiting to get the COVID vaccine. Right now, COVID-19 has been caused by one virus, the novel coronavirus, and that is the one where we have the high death rates, and it's very contagious, and we are being hit extremely hard in our communities, and especially the communities that TCC Family Health, that's our new name, is serving. Next slide. So what do immunizations do? And I think that, as a pediatrician, I think most people are comfortable getting vaccines for their children because we know it saves their lives. And I have had the privilege to work in many different countries in my career. And I've actually seen almost every childhood disease that we protect against with vaccines. And vaccines have changed the lives of so many children in the world because they shield us against serious disease. And I know that people that are born in other countries, they know about BCG protecting us against tuberculosis. And I think in many less developed countries, we still see people that have suffered from polio. And I think many in the audience may have even had polio in their childhood. And, we didn't have that vaccine until, the 50s or the early 60s. And we don't see polio anymore. So we don't see smallpox anymore. So it really shields us against serious diseases. And COVID-19 and influenza, as I said, are two different diseases, and we are going to need to get both vaccines to be protected. Now, the flu vaccine is here now, and we have it, and we should be getting it. The COVID will be coming, and I know Dr. Davis will be touching on that. Next slide. As I mentioned, why vaccines are important, it does shield us against serious diseases. And even if we do get the disease, it is a much milder form. And they work, it usually is a dead or weakened version of the virus that is given to someone in a vaccine. The vaccine really raises the body's alarm and tells it to produce antibodies. And antibodies are in our blood and they fight off the virus. So what it kind of does, it tricks your body in thinking that it's seen the virus, but it really only saw a piece of the virus or a virus that wasn't going to make us sick. So what the body does is creates these antibodies so that when we are presented the real virus, our body will go into attack mode and fight off that virus, and we won't get the disease, or if we do get the disease, it will be much milder, and that will save lives. Vaccines are much less risky than getting the real vaccine. So people are saying, why? I'm afraid to get the vaccine. Vaccines are so much less risky. And what we have to look at is the risk benefit. So they let your body prepare for being confronted with the virus, and the real viruses will cause and can cause much worse symptoms. And we know that our ICUs are filled right now and our hospitals are filled right now. And we are in a crisis mode. And so it is very important for us to seriously mask, distance, and get people vaccinated. Next slide. So I think adults will soon be able to get the COVID-19 vaccine. They've already started giving it in Long Beach, and I know Dr. Davis will talk about this. We will hopefully, as providers, be getting the Moderna vaccine, which was just approved in the next few weeks for our staff. Neither of them have been approved for children as of yet, and that will be coming down the road. There have been a few cases, and really just a few extreme allergic reactions to the vaccine. And so if you have a history of extreme allergic reactions, or what we call anaphylaxis, you either should not get the vaccine, but if you're in a high-risk group or in the, someone who has contact with patients, you can get it, but as Dr. Davis and I were talking this morning, you need to get it in a hospital where we have the medicines to give you. The cases that occurred in England, no one died from them. They were treated and they were doing well. So I think some people may have heard that the Pfizer and Moderna vaccines are different than other vaccines. It is using a technology which carries a messenger RNA into the cell, and then mRNA tells cells what to do and what proteins to produce. It doesn't go into your genetic makeup. It doesn't go into your genes. It just hangs out in the fluid around the nucleus. And it gives a signal for the cell to make one of the proteins and the antigens that look like the actual virus. And it tricks your body into attacking that protein that makes antibodies against COVID-19. So the protein is only a part of the virus. It's harmless to your body. And that mRNA that goes into the cell that makes the protein disappears from your body within 24 hours and at the latest 48 hours. So I hope this is comforting to you. So, and it was something that has been developed for many years and has been looked at and studied extensively. Next slide. So the side effects, some people worry about what the side effects may be from these vaccines, and it's very similar to other vaccines where your body is mounting an immune response, and that's a good thing. So you might have a sore arm, you might have some muscle aches, and you might have some fatigue, but it doesn't last more than a few days. And this actually means that your body is mounting that response. So all vaccines that are approved so far have been shown to work very well. Next slide. As I mentioned, the areas in Long Beach, and Dr. Davis will talk about this, the areas that are the darkest on this map are where we have the highest rate per 100,000 population by zip codes. These are exactly the zip codes where those that we serve at the Children's Clinic serving children and their families, now doing business as TCC Family Health. These are where our patients come from. So they are in the highest areas of this virus. And so they are in the areas that we have to be even the most vigilant and really try to get the vaccines out to them as soon as possible, but also to make sure that they understand the communities, all of our communities, understand how important it is to mask and to keep social distancing and really not have gatherings with non-direct family members because it is very contagious and it is passing from person to person at a rate that is frightening. So we really encourage everyone to, next slide, to keep your distance, wear your mask, wash your hands, and if you feel sick in any way, call your doctor, get a test, and stay away from other people. I think these are all the main areas that I think one thing is that if you're young and you think, I'm not going to get sick with this, why should I get vaccinated? It really is important for you to protect yourself. But by protecting yourself and wearing your mask and getting the vaccine and keeping distance, you are also going to protect all of those that you love and care about. And it may not affect you if you get the vaccine, but it could really affect those around you and those you love. And as Dr. Davis will probably know, it is affecting, all ages. So I really encourage you, and I know that we will all get through this, and it really takes all of us working together. And I'm so humbled and honored to be able to be part of this work in addressing this. And we are here for you, and I'm here for you, and please reach out if you need anything. Next slide. Questions? Will we have, okay.
Thank you so much, Dr. Nicholas. So I'm very fortunate to have Dr. Nicholas here as my CEO. It's such a pleasure to be able to work with TCC Family Health and introduce my CEO. She's such a very caring person to the children and serving in the community. So thank you so much, Dr. Nicholas.
My pleasure. Thank you.
And so our next speaker is Dr. Anissa Davis. And I'd like to give a little bit biography about her because she's so special to us here in Long Beach. She is our own health officer. So Dr. Anissa, she graduated from Long Beach Poly in 1987, and she also obtained her UCLA Bachelor's Art in History between 1987 and 1991. She's amazing. She went to Stanford Medical School and graduated in 1998. Following with that, between 1998 to 2001, she was part of the Public Health Fellowship through California Department of Health and Services. And from 2001 to 2003, she also was part of the Long Beach Health Department of Health and Human Services, along with between 2003 and 2005, she was in the public health physician in bioterrorism preparedness and response family medicine clinician in Los Alamitos. And between 2005 and 2016, she is now the health officer STD controller and TB controller at the Long Beach Department of Health and Human Services as of 2016 to the present day. So my apologies for reading up, but you have a very extensive academic degree, and I'm so very proud to introduce you. So Dr. Anissa Davis will be presenting on about COVID-19 in Long Beach and where we're at and where we're going. And for ado, Dr. Davis, please unmute yourself and share us a little bit more information.
Thank you so much for that kind introduction, and it was wonderful seeing all of you and to be able to follow Dr. Nicholas. TCC Family Health has been a wonderful partner and with all kinds of things, and so it's wonderful to continue that partnership with around COVID, unfortunately.
Please go ahead and share your screen if you have that option.
Okay.
We do apologize for that.
No worries.
All right. Thank you, Dr. Davis.
Yes, let me just get on to presentation mode. Okay. Okay, wonderful. So I am going to just talk about where we are and where we're going in Long Beach and around COVID-19, and share kind of some light at the end of the tunnel, some grimness in our present moment, and some light at the end of the tunnel. So just to give some background. So the cases in Long Beach, so this was as of the 15th. So we actually have more cases. We have, let me see here, a total of 2,000, we're in the 2,400s now. So as of today, and we do still currently have 97 hospitalized. Look at this. I'm trying to get the most up-to-date information, but my phone is not cooperating with me. We have 306 deaths. And as Dr. Nicholas mentioned, so that's the top here, and then the bottom is the same chart. And so basically you can see the darker areas are where COVID is hitting harder. These zip codes are being disproportionately affected by COVID, unfortunately. And these are also a lot of where people of color live. So currently we're at 24,622 cases. And we're at 311 deaths. So that's just in the last couple of days we've gone up. So this slide shows us the number of daily average cases since the pandemic began. So it just shows, you know, on one day, like how many cases were reported. And you can see that in our last surge, which was this summer, our cases increased by 243%. And this time they've already increased by over 1,000%. And they don't seem to be declining yet. So at the beginning of the surge, this current surge, which we consider November 1st, we were reporting about 40 cases per day. So that was average of how many cases of COVID would come in. And now we're reporting over 400 cases per day. Sometimes we're up as high as 800 cases per day. And we don't know when, and so that's in just 6 weeks, and we don't know when we're going to reach our peak. And one of the questions that I get asked is what could be contributing to these increases? And so we know that being physically close to someone that you don't live with, especially if it's indoors, and if you're not wearing a mask, is what really causes the spread from person to person. So those are things like eating together, parties, playing sports together. And so if you look on the graph, you can see that our summer peak really happened about 2 to 3 weeks after the 4th of July. And our current surge started right on the heels of Halloween. And then we really saw an increase after the Thanksgiving holiday. So we feel that gatherings has been a really large driver of infections because it's just really tied time-wise. It takes about 5 to 10 days to have a positive test after you have like a particular gathering, which is fitting with this curve. And we still, unfortunately, have Christmas and New Year's to get through. So this slide shows a few things. So the gray area is the cases, which is just very similar to the slide that I showed, the last slide. This brown curve is showing our hospitalizations, and then the blue curve is showing the number of deaths. So what you can see is that our hospitalizations are also rising exponentially. So the hospitalizations at the beginning of November for people in Long Beach, for Long Beach residents who were in hospitals, was around, again, in the 30s, and now it's 97. And then also in the area hospitals, so including like Lakewood Regional and Los Alamitos, so other hospitals besides Long Beach, we've also seen a very, very steep increase in people being hospitalized. And so what usually happens is the cases go up first, and then 2 to 3 weeks later, we start to see the hospitalizations start to go up. And then 2 to 3 weeks later after that, we start to see the number of deaths rise. And so that's the blue line, and you can see that that's also starting to rise now. We are, because of all these hospitalizations, our intensive care unit bed capacity has really decreased dramatically. We're at a critical shortage. For the Southern California region, which are the counties from San Luis Obispo to San Diego, the state projects how much bed capacity we have every day. And currently for the Southern California region, we're at 0%. So effectively, we don't have ICU bed capacity in the Southern California region right now. And that's a mixture of having so many people hospitalized and then not having the staff available to meet that demand. So this slide just shows the age. Dr. Nicholas had mentioned that younger people do get sick. Younger people have a lot of infection. So you can see at the beginning, on the left here, you can see at the beginning of the pandemic, the median age got as high as 48. So that meant half of the cases were above 48 years old and half of them were below. And now in November, you can see that the median age has dropped dramatically to 34. And then you can see on the left here, each of these colored lines are a different age group. And what's really striking is most of the age groups are kind of all together here, but the 25 to 49-year-old age group is really contributing to a lot of the spread and a lot of the cases of COVID in Long Beach right now, both in the summer surge and then in this current surge as well. And then just to go over, yes, you know, most younger people do okay. They have less of a risk to have serious illness and death from COVID, as opposed to those who are older or have underlying health conditions. However, up to this point in this pandemic, we've had in Long Beach, we've had 2 people who were between the ages of 18 to 29 who have died so far. And we've had 10 people in the age range of 30 to 49 who have died so far. So even though, you know, it's, you're definitely at lower risk, you're not at no risk. Like, it is a significant issue for everyone. A lot of people also, there's a new, evolving understanding that some people can really have symptoms that last for quite some time. You can have where you don't think the same anymore, like maybe you're a little bit foggy, or you have a lot of fatigue. Sometimes there's chronic headaches. It can give you lasting heart issues. So even though you may be at less risk to die or have serious illness, there's definitely young people who are kind of feeling the effects of COVID for quite some time after they're infected. This slide just shows some differences in race and ethnicity. So on the very left here, it shows the cases by race and ethnicity. So the dark blue is the percent of the population that this race or ethnicity has. So that's what you would expect. So the Latinx or Hispanic community makes up 42% of the Long Beach population. Caucasian or white makes up 28% of the Long Beach population. Asians make up 13%. Blacks make up 12%. And there's 3% other and 1% Pacific Islander. So that's what you would expect the cases to be as well, and hospitalizations and deaths. You know, if you're 42% of the population, you should be 42% of the cases, 42% of the hospitalizations, 42% of the deaths. But what you see here is for the Latinx population, for cases, they are kind of mirroring their percent population at 41%. White people are getting infected to a lesser degree than what you would expect for their percentage in the population. Asians are 5%. So they represent 5% of those getting infected. Black people represent 5% as well. And then Pacific Islanders are 1%. However, there are 33% who don't report their ethnicity and race. So we just have to take all of this with a grain of salt, that some of these other categories might be a little bit higher because people haven't reported what their ethnicity is. And then in the middle here is hospitalizations by race and ethnicity. And so again, for the Latinx population, it's 42% of those are also hospitalized. White people are hospitalized at a lesser extent. Asians are hospitalized a little bit less. African Americans, there is an increase. So African Americans are more likely to be hospitalized than you would expect. And then others and Pacific Islanders are also a little bit higher. And then there's 9% that don't report. And then COVID deaths for race and ethnicity. So the Latinx population is, for Long Beach, is represents 38% of the deaths. It doesn't have the percentage here, but for Caucasians, are a little bit more of the deaths, and then Asians is what we would expect in the population. African Americans are higher, so they're dying at a higher rate than you would expect from COVID. And then Pacific Islanders is what you would expect. And then for deaths, because we do, you know, you have to submit a death certificate. We usually have a conversation with the hospital. This is pretty good data as far as race and ethnicity. I will say that because the Latinx population tends to be a younger population that's getting infected, that's one of the reasons why you're probably seeing that they're not dying at a rate to where they should be, because they are having a lot of infections. But I think it's just because they're in a younger population. Whereas with the white population, the reason why this is higher is because many of our long-term care facility or skilled nursing facility residents tend to be white, and they're at really increased risk to die from COVID. And so that's why you're seeing that. And this just goes over, again, the hospitalizations. So the yellow line is kind of our Long Beach area hospitals, and then the blue line is Long Beach. And so you can just see that since November, things have been increasing, unfortunately, which has really been a problem for the staff in hospitals right now. So just to go over a little bit what we know, some of this will be a reminder. So transmission occurs via respiratory droplets, and also sometimes it's airborne. So it's basically droplets that are coming out of your mouth and your nose, and either they're big droplets and they kind of just, you know, they travel for a short amount of time. So it's more a problem if somebody's standing really close to you. Or they can be smaller droplets, and then those can sometimes stay suspended in the air. And that's really a problem when you're indoors in close quarters, especially if there's a lot of people and you're not wearing masks. It can cause a wide variety of symptoms that Dr. Nicholas went over. And there's 40% of people who may not have any symptoms at all, which presents so many problems with knowing, when you should stay home, when you should get tested. That's why wearing a mask all the time is so important, because asymptomatic cases can transmit the virus. Most will have a mild disease, but as we talked about, all age groups are at risk of having severe disease, having to be hospitalized, dying, and then having those long-term consequences afterwards. And then those with severe infection do tend to be older adults and have pre-existing conditions. And the pre-existing conditions, they are things that many of us live with every day. So things like diabetes, we're taking our medicine, we see our doctor, high blood pressure, obesity, smoking. So these are relatively healthy people. They just have a medical condition that they're treating, but that is enough to put them at higher risk for severe illness and death. What we don't know right now, so we don't know if reinfection can occur. It does happen. We don't know to what extent though. So there's been like a handful of cases where somebody has had COVID, we're pretty sure that's what it was, and then they ended up having it again. But we don't think that this happens. We haven't seen it within the first 3 months. So if you have COVID, we believe that your body has immunity for at least 3 months. Dr. Nicholas talked about different strains. We don't know at this point what happens if you're exposed or come in contact with different strains. So we'll be watching that evolving data. And we still need to find out long-term effects of COVID. So COVID, didn't come to the United States until February, and so, or January. And so we are, we haven't even made it a whole year. So we're gonna be doing a lot of study around that as well. And then we also don't know how long the vaccine will last. It was studied, the 2 vaccines which are going to be authorized. One already is, Pfizer and Moderna should be by this weekend. Those vaccines were studied for 2 months. And so we know that they work for 2 months. And so we just need to know how long they're going to last in general. And that's going to be following a bunch of people over a lot of time in order to figure that out. So, so just to go over a little bit about masks. So when COVID first started, there was a lot of questions about masks. We didn't know how effective they were. Disease prevalence was really low. We didn't have enough masks. And so at the beginning of this, we weren't asked to wear masks. But now there's been several studies. There's a lot of data. This is really like a done deal. We know that masking works. Like that is not something that needs to be discussed or wondered about anymore. And there's a lot of things out there that we've seen. So they've studied states where there were mask mandates and states that where they didn't have mandates, and they saw that infections rose faster if you didn't have a mandate. They've seen things on flights, like if you wear masks on flights, then you're much less likely to get infected than other people who weren't wearing a mask on a flight. There were 2 hairdressers, I think it was in Missouri, and they saw 139 clients while they were both contagious. They wore masks the entire time, and none of their clients were infected. They infected each other. And so that just kind of highlights that it's usually the people you're around all the time where you kind of let down your guard. So it's usually not like when you're at work and everybody's really being, careful. It's, what you do in the break room, what you do in the lunchroom, or what you're doing after hours. So some of the other data that we found is that it not only protects those around you. So the main reason why we say to wear a mask is because you can be asymptomatically infected and contagious and not know it and infect other people. So by wearing a mask, it really prevents those droplets that we talked about from infecting other people around you. but we've also found that it protects the person wearing it. So if you're wearing a good mask that has like a tight weave where you can't see through it and it has more than one layer, 2 layers is better, then it also filters the amount of infectious particles that come to you. It filters out the air that you're breathing as well. So it protects you and it protects the people around you. You still need to socially distance. However, nothing is 100% with COVID precautions. They compare it to like Swiss cheese. So each precaution is kind of, you know, Swiss cheesy. It has some good parts, it has some holes, but when you layer them on top of each other, then you get, you know, the best that we can do right now for precautions. So everybody needs to be wearing a mask. Everybody needs to be washing their hands. Everybody needs to be watching their distance, trying to do things outdoors. All of these things prevent transmission. So just a word about ventilation. That's another thing that's new that we've discovered, is how important it is to have good airflow, good air exchanges, it's called. So you just want stuff moving and getting dispersing. So, so these are all little droplets that can cause, all these little pink dots or little droplets that can cause the virus, that can cause infection. So when the doors close, when the window's closed, it's just kind of all hanging around in here. So even though these two are distanced, you know, it's just they're together in this room for probably a long period of time, and so the droplets can kind of hang out. But if you're able to open the window, get the air circulating, get your, you know, HVAC, your air conditioning system going, it will help to disperse these droplets and then prevent infection. So that's what's really important if you're indoors. So quickly, just, you know, wear a mask, avoid crowded indoor spaces and ensure indoor spaces are properly ventilated. Avoid close contact with others. It's people that you don't live with. With that high curve that I showed, you know, COVID is everywhere, and you really need to assume that everyone around you could be infected, is infected, and they just don't know it. And so you just have to wear your mask. You have to stay 6 feet or more away from them. You can't have parties right now. You can't have gatherings. I know it's horrible. But I think if we can just get through this next like several weeks, like, you know, get through January, I think we can get to a place where we're able to do those things again. But right now, with the way that our infection rate is, like, it's really dangerous. Cover your coughs and sneezes, clean and disinfect frequently touched surfaces. They are saying, like, this is important, especially in your home if people are infected. However, they're not seeing that touching things that have been infected or have the virus on them is a major driver. It's really being close to somebody and breathing the same air. Monitor for symptoms, that's very important. Don't go out if you're sick. Use hand sanitizer with 60% alcohol and wash your hands often. I think just a couple more. So what's coming? So that's where we are. It's kind of grim. However, we've got some light at the end of the tunnel. One is vaccinations. So Dr. Nicholas reviewed the technology, and it has been shown, it's been studied. They really made an effort to study the vaccine in a very diverse population that mirrors the population of America. And they did a pretty good job of gender, race, people, older folks, people with underlying health conditions. And they found that both of these 2 new vaccines that are coming out are 95% effective kind of across the board. And safe, so no major things like Dr. Nicholas talked about. So who's going to be vaccinated first? So the healthcare workers will be the first in line. So basically we looked at who is more likely to come in contact with somebody with COVID and protecting kind of that, that workforce, those folks. So healthcare workers will be first. And the thing is, we're not getting enough vaccine to do everybody all at once. And so we are doing it in phases. And so we had to prioritize because of that. So healthcare workers are first, whether it's hospitals, clinics, public health, home health, paramedics, etc. Then it'll be essential workers will be next. So that's police, transportation, grocery store workers, educators, others in that class of essential workers who are out there on the front line that aren't able to work from home. And then those are at high risk will be next. So older than 65 and those with underlying health conditions. And then after that will be the general public. So we're starting, in January with the healthcare workers. We're planning to get to the essential workers like late January, beginning of February. And then after that would be those at high risk. And so the general public would probably be spring, somewhere in the springtime or maybe like early summer. The more information will be coming out around that. And then the last thing to talk about that's also coming is at-home testing. So one of the issues is, if you're asymptomatic, it's hard for you to know whether you were infected. And right now, you can go and have a test at one of our testing sites, which we have 5, and we're testing over 4,000 people a day, and it's free. So it's a good system. It takes 2 days for the test to come back, usually 1 to 2 days. So you have to go there, you have to take the test, you may have to wait 2 days. And so it could be that by the time you get your result, it may be too late to really do the decisions, to do the things that you need to do, which is basically stay at home, tell people that you're around, that they could have become infected, so that they can get tested. So just a couple of things that are on the way is there's a test now that can be done from start to finish from home without a prescription. And it's called Illum, and that's this one here. And then there's another test called Buy Next Now, which can be used at home with a prescription for those that are 15 years of age or older. So I think that the at-home testing is also going to be a game changer along with the vaccinations that are coming. So to end, there is light at the end of the tunnel, but it is still a really long tunnel. Vaccines are going to take a while to see an impact. There's not enough of them right now. It takes 2 weeks for them to take effect. You have to do 2 of them, and you have to have enough people in the community to be vaccinated. The goal is 70% of a community to be vaccinated in order for the entire community to be protected. Home testing is not widely available or cheap enough yet. So we need to keep doing the right now strategies, the ones that work right now, in order to get to the end of the tunnel or to get down the road. So cancel your travel plans and stay at home with only your household for the holidays so that we can get down the road and to the end of this thing. Thank you so much.
Thank you, Dr. Davis, for this amazing information. We will have a young gentleman. His name is Manolo Montoya. Let me just give you a little bit background about him. So Manolo Montoya, he's 15 years old, if I'm not mistaken, and is a Long Beach resident. He's very artistic and is very dedicated to serving his community. He writes poetry and composes music and produces his own music. He wants to inspire other youths to pursue their dream and to definitely help others as well. So I would like for him to unmute himself and basically present to you his rap song that he composed himself called Respect Culture.
Thank you, Mrs. Chi, and I'm honored to be here. Anyway, good morning to everyone. How are we doing today? Great? I hope so. Anyway, this is my culture rap. Everywhere I look, I see that the world is kind of in a disaster. I do see that things aren't going very well. But to lift everyone's spirits, I think that we should all remember where we come from. So, vigilante, baby! Respect culture, and it includes my background, my morality, my faith, and my family handouts. Don't understand how everybody wants to disrespect and make fun of what our family passed down. Respect culture means to take a second to self-observe. I'll respect yours if you respect mine, that way no one gets hurt. Remember what you stand for and for the purpose you serve. Look, I'm asking for you to respect my dreams and focus. My culture is where my home is, and as a warrior, it's in my motives to share with people my own devotion and showing in full force. Of course, it seems like I'm way too annoying. Remember your family members. I'm just trying to make a point when I'm writing these happy letters, trying to take your attention and shift your mind to the lesson I'm teaching. I'm literally preaching for you to pay homage to your religion, and it's the truth. It doesn't matter to me, rather it matters to you. I'm just hoping you know the decision to choose and spreading the message. It's hard to sympathy to a bruise, leaving the Lord amused by hearing the only news. They might have you feeling the blues, but now I'll tell you what you can do. You can love your neighbor as you love yourself. That way everybody's happy, but most importantly, everybody's in mental health. Culture can be described as family tradition, or maybe personal interest, maybe painting or fitness, soccer, dancing or singing, maybe practicing dentistry, maybe it's our religion. It could be watching anime, maybe cooking a recipe, maybe family industry. But whatever it is, I can't say that I'm ignorant, because I have my own culture as well. And I'll praise you for doing well instead of yucking your young. So I'm about to be out here spitting the fast, lower deliverer, and never last. We could be together while having a blast instead of handing on each other for family values. I think that racism should be left in the past. It doesn't matter if you're Asian, Latino, or Black, or any other race that God has made with his hands. We all live on the same stinking planet, but no one is perfect. God has commanded that we all love each other, so I love you like a family. Do you understand me? We were meant to be family, so let's cease all the calamity, put an end to the travesty. We can prevent the tragedy, put an end to the blasphemy. We can call this humanity, we can make this reality. We can take all our energy with the vitality and take all of this true loving and apply what we're preaching practically. That way humanity can be happily, casually, sporadically, frantically showing love in bigger opacities. Family. Respect culture, that includes my background, my morality, and my faith, and my handouts. Don't understand how everybody wants to make fun and disrespect what we pass down. Respect culture, it means to take a second to self-observe. I'll respect yours if you respect mine, that way no one gets hurt. Remember what you stand for and for the purpose you serve. Vigilante, baby! I'm honored to be here. Thank you, everyone. I appreciate it. This was a great honor for me to be here, and thank you, everyone. Stay safe.
I would like to share a little bit biography about Mr. Mario Gonzalez. So Mr. Mario Gonzalez, Ernesto Gonzalez, is the manager of community relations for the Port of Long Beach here in California, the nation's second busiest seaport. So the port is a primary economic engine for the city's nearly 500,000 citizens, supporting 1 in every 5 Long Beach jobs. And Mario joined the port in 2009. He is the port's primary community liaison, and he is responsible for the port's community and education, outreach, and workforce development. So Mario attended Cal State University of Long Beach, where he earned his bachelor's degree in behavioral sciences and a master's degree in public policy and administration, focusing on urban affairs. It's my pleasure to introduce everyone to Mr. Mario Gonzalez.
Good morning, my name is Mario Gonzalez. I'm the manager of community relations, and I'm here to give you an update about the Port of Long Beach. So as mentioned earlier, the Port of Long Beach is a proud sponsor and supporter of Khmer Parent Association. Thank you, Chan. Thank you, everyone, for being here. Okay, so the Port of Long Beach is managed by the Harbor Department. So I'm a city employee. I work for the Harbor Department. The Harbor Department manages the Port of Long Beach. And we have 5 harbor commissioners that set policy for the port. And as you can see here, currently our president is Frank Colonna. He was a former council member. Steve Neal is our vice president. He was also a former council member. And Bonnie Lowenthal, she's also our commissioner. She was a former assemblywoman, a councilwoman, also on the Board of Education. So she has a long history here in Long Beach. Bobby Olvera recently joined us as well. And he represents, or he in the long ILWU, the folks that work on the docks. And then our last commissioner here is Sharon Wiseman. And she has a long history as well with the city of Long Beach. And so these are the individuals that are appointed and confirmed by City Council, and they're volunteers. And they are the commission that is responsible for setting policy for the Port of Long Beach. Okay, so you can see here's an aerial of the Port of Long Beach and the Port of Los Angeles together. When you combine Port of Long Beach and the Port of Los Angeles, we are the 9th largest seaport complex in the world. In United States, Los Angeles is the largest port in United States, and then Long Beach is the second busiest seaport in United States. And together, we import over 40% of everything that comes in on ships. So this here kind of gives you an idea of how busy the port has been in the last few years. In 2018, that was our busiest year ever. We moved 8.1 million containers or TEUs. Last year was our second busiest year ever. And this year we're finishing up pretty well. So we'll definitely have a record year finishing up in 2020. All right, and again, because of how busy we are, we also have, you know, quite a bit of jobs that are supported by the port. So in Southern California, 1 in 20 jobs are supported by the Port of Long Beach, and in Long Beach alone, the Port of Long Beach supports 1 in 5 jobs. That's over 51,000 jobs that are supported by the Port of Long Beach. And with that, also our air emissions. Every year, we're always measuring how much emissions we are created by our operations, and you could see here that we've made quite a bit of progress. Diesel particulate matter is down by 88%, even though our business is up by 14%. And also, in addition to improving the air quality, our commission has set a goal of making sure that all the trucks that operate at the port become zero emissions by 2035. In addition to that, I wanted to mention that this was one of the projects that we've been working on for about 10 years. I'm not sure if you've had a chance to drive over it, but the new bridge is open. This one is replacing the Gerald Desmond that's right behind it. Yeah, this new bridge is a lot taller, allowing for bigger ships to enter the port in the north part of the harbor. There's also emergency lanes in case there is an emergency. And you can see that it's lit up. It's lit up at night. All right, so this is our community relations team. As you can see that we have a new logo for the port. And so I wanted to talk to you a little bit about some of the opportunities that are related to education and workforce development. So every year we have high school students that intern with us, as you can see here. Last year, unfortunately, last summer we weren't unable to because of COVID, but we're working on something that we could possibly do next summer that is more of a virtual program. We also offer internships for college students as well as high school students. So the internships are really important because it allows a person to, you know, familiarize themselves to explore the career that they're interested in before they pursue that career. In addition to internships, we also have scholarships for high school students and college students at Long Beach City College and at Long Beach State. But for high school students, the application for scholarships opens January 4th and it closes on March 1st. So scholarships ranges from $1,000 to $5,000. So, and another partnership that we have is with Long Beach City College, and it's the Maritime Center of Excellence. And this is for individuals that are interested in learning a new skill or wanting having an interest in the maritime industry. And so these are short-term classes, and they will be starting in February. And so all of this information and more about the Port of Long Beach, about its initiatives with air quality, our capital projects, all can be found online. But I did put the website there for our education programs. It's polb.com/education, where you could find more information about scholarships and internships. And hopefully soon, you know, when things clear up and we get COVID under control, I know, Chan, we've done this in the past for KPA and host a harbor tour so we could see all of these, the port on water. So until then, thank you so much. And happy holidays and Merry Christmas and Happy New Year.